Good morning or good afternoon, depends your time. To all, we have 23 people coming in. We expecting a little bit more, so we stay. Let's say it's 2 p.m. sharp, so we stay 2 minutes more, and we will start with Professor Kyung within 2 minutes.
Very good.
Tiens, plutôt 20 minutes par speaker, puisque les questions, c'est le panel par définition.
Yeah, you will have 15 minutes around that for your presentation. So you are 4 to present, and after we will launch a open speech discussion on the COVID issues, and I will suggest you a couple of thematics where we can talk about, and I think the fact that we are all coming from different countries makes the things much more interesting, because on this global crisis we see that there are so many differences of treatment of emergency crisis management issue that it's very interesting to discuss those matters. So I will suggest 4 things. It will stay roughly 1 hour, and we will start this discussion after the Q&A and after, of course, your presentation. So now I think it's it's a 2 p.m. French time, Central Eastern Time. So we are going to launch this afternoon on COVID again. It's follow the yesterday morning session that we had, and I would like to launch first the Professor Dr. Kyung. So Dr. Kyung, you are director of the UNDP China Risk and Resilience Innovation Project. You are also the director of the Innovation Center for Risk Governance in Beijing, and you are the vice president of the China chapters of TIEMS, and board member of the China Society of Emergency Management. So I hope that everything is good enough. And I'm very glad to give you the floor for your presentation. Thank you, sir.
Thank you. Thank you for the moderation. It's my great pleasure to join you to discuss those crisis management issue, globally. Let me share my slides, okay?
Sure.
So can you see the slides?
Yes.
Yeah, I think many experts know very well about our Chinese domestic system on crisis management or emergency management. But today I will use 15 minutes to introduce those new phenomenon in China. I think it's the COVID-19 is a global issue. So China as a newcomer of the international humanitarian system. So I will introduce some, the observation, on those phenomena in China. So I think maybe it's a beginning for, how we can enhance our international collaboration in those global humanitarian system. So my title, my topic will, focus on those emerging collective learning model. So because it's like how those China, we can switch from those bilateral system to multilateral system. So I just, because those story, with us, with our center, after the 2015, we participate those response to the Nepal earthquake. So we have a team. We went to the site. We work with Nepal. The colleagues, the local society, and we also set up. After the COVID-19, we set up a China NGO consolidation for the COVID-19. It's like we work with a government agency and international agencies. We how we can collaborate with the society to respond to the COVID-19. So you can have a look at those picture. And we also have a network. We also, work with UN OCHA. Every year, UN OCHA will host a big, it's like gathering It's a HNPW. It's Humanitarian Network Partners Week. We also this February we also co-host a session on the SARS collaboration. I think you can see those. I think it's a direction for China. We also work with the WHO Academy. There is a learning strategy because in China we look at it's a huge country. When we do those humanitarian response or the emergency management, it's not only we need those support from the government agency, I mean the different levels of the governments, we also need the society how to engage ordinary community, ordinary people. So we treat learning as a very important the factor how we can mobilize our society. So I also joined the WHO, the new, the group for the learning strategy, because WHO is setting up a new academy, it's named WHO Academy, to facilitate those global learning. So we also launched a program. It's like an online program, so named Humanitarian and Development Initiative, Sustainable Development Initiative. We work with those different UNDP, UN OCHA, and UNV, and the IFRC, and different universities. We deliver a global online academy during the pandemic. We try to, it's like you can see the different module. It's like the first module is about how to understand the risk and the sustainable development. Then those WHO and the different agency will deliver.
Je l'allume, je parle et il faut que j'active.
Excuse me, please close the microphone if you are not the speaker. Thank you.
Oh, yeah. Should I continue?
Ah oui, d'accord. Okay.
Mr. Barbet, please. Eric Barbet, fermez
Oui,
votre
Monsieur Barbet, fermez votre micro, s'il vous plaît, vous interrompez la conférence.
Bon, merci.
The second module, because it's like how to support healthy issues and the risk of governance. The third issue is about, how to build up the community resilience. So that's I just give you an example and our experience on those global collaboration. So I think there are many debate on those how to review those COVID-19 experience. I think that there are some different many articles to discuss. I just quote a paper from the Ajib Shaw. There call for more, stronger knowledge and science provide promotion and more those how to mobilize existing the governance structure. And I think it's a very important thing is how to understand those different economical and social impact and how to mobilize those bottom up. It's very important. It's like within the society, how we can combine the top down and the bottom up approach. So when you look at the international humanitarian framework, it's very complicated. So you can look at there are many different those agencies and international NGO, international organizations, and the local and the country, the nation structure. It's like it's a multi levels collaboration. So I think it's you can see those UN agencies. I think those efforts. It's like they give us, a lot of appeals and the plans, then call for attention and the resources to join those UN pool to work with the different countries and different societies. So,
peut-être que c'est lui qui l'a enlevé. Peut-être que c'est le...
Monsieur Barbet, s'il vous plaît, fermez votre micro parce que vous interrompez la conférence à chaque fois. Gardez votre micro fermé. Merci.
I'm sorry, I cannot. So should I continue? It's okay. Any question or something?
No question. Sorry, it's a technical problem with one of our speakers later on. So please go on.
Okay, thank you. So I think it's there are, you can see those I think those efforts from those UN agency. I think it's it's good how we can work with together. I think beyond those traditional boundary of the country. So you can see those ultras, the chat. You can see those different the countries' contribution. You can you can see the China. And also those money go to the coordination, education, the food, the nutrition, and the different sector or different needs. I think it's when you look at it, we don't have those exact data. I mean, during the pandemic, but we just participate a new. I mean, the state of the humanitarian system, the 2018, because the report will be conducted once during 3 years. So you can look at those global humanitarian. You can see the humanitarian needs is very high. There are more than 200 million people. I mean, suffering from those humanitarian need, humanitarian crises. Then there are, also about those unexpected crises. It's I think it's COVID-19 also gave us it's a big lesson. So about those unknown. I mean, we don't know those mechanism. We also don't know those exact impact on human being. So I think it's you can see there is a huge gap between the requirement and the funding. I mean, in those humanitarian response system, we also need more funding and more attention. How we can enlarge the system, how we can work together. So there are different the framework for future. So Sendai framework. So it's like how we can engage all of the society. We also work with those, I mean, government agency, and we need those non-state stakeholders, and we need international collaboration and global partnership. So I think it's like now we want to build up some new paradigm. It's like from the cooperation to collaboration, especially during the pandemic, because it's an unexpected crisis. It's a mega crisis. So it's those those uncertainty, great uncertainty. It's increasing those complexity. So we should work in a new way. How we can reframe those collaborative governance. It's like before we just we say cooperation because we have the common goals, we have the shared norm, we have the open communication, but we still, I mean, it's like the organization to organization or the country to country. But now we need a collaboration. It's like maybe we need more the power symmetry, and it's like we can cross those traditional boundary. Then we use a new new forms of the organization to solve the problem. So that's the things. There are also some, I mean, those some issue we need to conform. So I think when I introduce those framework, it's like that's the phenomenon, I mean, emergent phenomenon in China, because we try to, before we rely on those bilateral, so it's like those traditional, I mean, those concept model, the collective governance model, because we rely on those prehistory, how we can create more incentive, how we can use those power, resource, knowledge, asymmetry. Then we should do those collaborative process. It means we should build up those trust. We should create the framework to do those face-to-face dialogue. We should do those how we can share those, I mean, build up shared understanding. Then for China, it's like I think it's we need, I mean, for I just you can see the picture. It's like before we just work with those developing countries just by a bilateral way, but now we engage more and more those UN agency and international NGOs, or for example, TIEMS also is it will be a good the channel we can work with the different society. So it means we can build up the new base of the society. It's like we should. Through those G2G, but it's not only through this way. We also is like use those different C2C, it's like civil society to civil society and the people to people approach. So I think that's an emerging phenomenon. In China, we also have a new pathway. If, for example, more willingness on the global development, because it's like we welcome those SDG from the UN agency. We use the Bold and Road initiative to work with those countries. And we also have more input on the SARS collaboration. We set up a new fund to support those collaboration. We also, that is we have a new, government structure. One thing is from the domestic side, it's named the Ministry of the Emergency Management. So it's a new structure. It's like we put as our national strategy. Now we put the safety is a very high, the priority with development. So now we also have a new agency. It means named China International Development Collaboration Agency. They deal with those international collaboration. So you can see even within the Ministry of the Emergency Management, there is a new department on the international collaboration and the international humanitarian response. Then it means how we can work, link those domestic development and the international humanitarian response. So then you can see those, I think we are on the way, because if you can check those UN system, those financial system, the FTS, those financing tracking system, you can see those currently within the multilateral system and the UN pool, you can see the China's data. I think mostly we put the resources to the 3 countries, and we don't rely those the multi-level pool very much. So it's like you can see, but I think it's you also can see those China's new phenomenon. The China enterprise go abroad. That one more and more the China's the investment to go to the different society. We also have a new sector. It's the Chinese NGOs, because they within China registered the NGOs now is around it's like 900,000 registered NGOs. If we add those unregistered NGO or the voluntary organization, you can see a big number. So they participated. The right the picture shows those different during the response to COVID-19. There were different organizations to take in the different province. They participate those the humanitarian response. We also, it's like the 2015. After 2015, there were more. There were a new those NGOs participation into international humanitarian community. So it's you can see enlarged the scope. They focus on the capacity. They build up the collaborative structure with international NGO, international agencies. We also use those ICT technology and adopt the international humanitarian standard. I just want to give you a sense about the China's the pattern, because it's not just the government to deal with international collaboration. It's also, it's like you can see it's very complicated. It's not just multi-stakeholders to participate in the system. So you can see those, we also how to connect the different countries. We have the different domestic the disaster risk management. Then we can connect with each other. China now, they pursue, I mean, we are pursuing those different channels, not just the G2G. We also work with through the UN agency, the international organizations. Then we can work with those, I mean, local to local, the city to city, the people to people. That's a new phenomenon. So I think it's there are also some, I mean, issues or challenging issues, because it's like how we can understand those nexus of the humanitarian and the SDG. I mean, during the globalization, there are huge, I mean, debate on the globalization during the pandemic. So how we can treat the globalization is a very important way, I mean, for in the future. So the second issue is about how we can engage ordinary people and I mean, within China to build up a friendly environment for those collaborative learning. It means not just learn from domestic partners, it's also learn from the different contexts, from the different society. The third issue is about those the policy framework. It's like how we can give those the suitable the policies to support those.
Sorry, Dr. Chang, the time is going very fast. You should conclude.
We just last slide.
Thank you.
The last, yeah, thank you. So I think it's very important. That conclusion is like you can see in China there are multi-stakeholders to participate emergency management system, and we are more and more attention on those how we can participate in international humanitarian response. And there are diverse approach within China's system. It's a you can see the blue the boundary. I mean, you know, those global and the domestic system. So how we can create a learning, I mean, the cycle. So I think there are some questions for us is like, do we have a consensus on those? I mean, after the pandemic, I mean, how we can treat those safety and the sustainable development? What's the motivation and impact for those international collaboration? And how we can pursue a new way? That's an ecosystem. So thank you very much.
Thank you very much, Professor.
I start the sharing. Okay.
Yeah, thank you very much. And I think those the word I will keep its collaboration, and I think that we will discuss a little bit more either during the Q&A and the debate, because you raise a lot of very interesting questions, especially the collaboration at the state level and at the regional and international levels when you face global crisis like the one of the COVID. It's very interesting because we see that sometimes the resources are a little bit short for everyone. So how to do with that? It's a big story. So now we are going to give the floor to Professor Simona Cavallini. You have already been presented yesterday, Professor. So in order not to lose the time, I let you make your presentation right away. Thank you. Open your mic, don't forget.
So let me share my screen.
Yeah.
Where is my presentation?
It's a green on the bottom.
Just to be sure that you can see.
Yeah, good. You can put it in full screen, and that would be perfect.
Did you see full screen now?
Yeah. No, we see not full screen. So you can put the full screen.
Yeah. Let me have before to put the full screen.
I think you need to share first and to put the full screen after.
Okay. Let me try full screen.
You can share first. Okay. Yeah.
Okay, sorry.
And good. Perfect.
Yeah, just a second, because I'm at the end of my presentation. Oh, okay, sorry. Okay. So thank you very much for inviting me for this session about the COVID. What I'm going to present now is my work, my future research work on how to reconsider impact profiling of biological events after COVID. The challenge of my work, of my research work, is to understand how to better design the biological threats, biological events such as pandemics, to support decision makers and policymakers for the right decision or investments in preparedness, in response, and in recovery. My idea is that information on the evolution of such events is crucial to take the right decision in the different phases that they are going to face. We have first responders that usually works in this kind of crisis, but we have also to think that policymakers and decision makers at national level and here in Europe at European level should take the right and prompt decision, and having a good set of information about the structure and how this kind of events behave is crucial to set a good strategies. So policy and decision makers addressing CBRN events as some challenging task. So at the beginning, should they define the strategies and set up investment to address these potential events? They have to act in the response phase to promptly implement action and use resources to set up, to help, let me say, first responders. And they have to act, I think, maybe is a very important phase of their work, to restore the normal life condition, reducing the social economic losses, the social economic effort in the short time, so very quickly, and then reduce also the propagation of the effect of this kind of events. This gives you how in Europe policymakers address the CBRN events. In the last, at least in the last 20 years, the terrorism was one of the key points in the policy agenda of policymakers. So a number of EU regulations were issued to address the aspect of CBRN events. We are in the world before the COVID-19, so CBRN events are something related to terroristic attacks. So we have two communication for people that is involved in CBRN management or crisis or threats, something like this. They are very well known, this type of communication of the European Commission. We have the European Action Plan in 2019 and the communication of strengthening CBRN security in Europe and the action plan in 2017. We see that key points related to the impact of this kind of events are related to human life, economic effects. I just mentioned and the parts of this communication, and you can see that the focus is on health and economic effects. So policymakers are addressing this type of effects as the impact of this kind of event. And one of the main issues that, not issues, but better the point that European policymakers would like to stress is that also small-scale attacks can generate significant effects. Again, 10 years after, more or less in 2017, we have again the focus on the number of victims, the economic impact on the society. But I think that a new step after some years is achieved in terms of another type of effect, that is the psychological one. So the effect of terroristic attacks as on citizens that suffering in the area of the terroristic attacks, but also worldwide, some psychological effect that should be taken into account. So focusing again on the fact that also small-scale events or attacks have a huge impact in economic effect, but also on society. Maybe we can say that in the last 20 events, biological events are treated essentially as the other types of CBRN threats. And on the other side, we focus on the human dimension of this kind of events. So the attention was focused on events caused accidentally by human errors, generated by technological disasters, or that were created intentionally by criminal, malicious, or terroristic attacks. So there was, I think, a human-centric view on what is a biological threat. These are some parts of the Council conclusion that is reported by the European Commission. So again, the focus is on material that can be produced, transport, handled. So something that is very related to the human activities. And factors, for sure, affecting the severity of the potential impact, social, economic, psychological, range from a number of characteristics of where the events occur, but also from other characteristics such as the type of the material, or which is the state of the art, or sorry, better, the capacity of the health system to manage the local, in most of the time, health system to manage the consequence of the event. There are some, and there are a number of attempts in literature to assess the impact of CBRN events. I just reported a couple of examples focusing on biological attacks. And most of the part of the literature in the last 20 years focus on terroristic attacks. So one is related to Kaufman and other authors. And they try to assess which is the cost of such biological events based on the attacks. I think the huge challenge for people working in economics is to find the proxies to measure this direct and indirect effect. In this case, for instance, one of the key elements was the cost of hospitalizations that were taken as the cost of a possible attack. So a number of attacks were supposed, and the cost of hospitalization were used to make a comparison of the cost. Time in the response and in assessing the costs has a crucial role for a proper assessment. Other studies, such as the one of Rand Corporation in 2005, look at to the losses for insurance companies. So in two types of anthrax attacks, they simulated an attack within a building and then in a wide area. In this case, for instance, time was not included in the analysis of the impact and of the damage. My research on this domain started some years ago, and one of the most interesting contribution was a paper of Ramseger that defining some categories of economic impacts or economic effects generated by all the type of CBRN events. So costs related to first response measures, recovery, reconstruction, and restoration, indirect damages, and microeconomic losses. More or less 5 years ago, I focused on highlighting the second dimension that should be taken into account for biological events. So what we mentioned as large-scale effects of Ramseger, we added a second element that is the persistence of the effects that is very that is characterizing the biological events. These are some comparison that we did between the biological, the events involving biological material and the events involving other types of material, such as chemical, nuclear, radiological. So just to mention that the occurrence of symptoms is very delayed in most of the biological events. So, not very, but most of the symptoms are delayed. So this is a factor that can affect, for instance, the persistence of the events. And then there are some other effects, factor infecting persistence, such as the difficulty to detect the biological threats, or something like this. So we try to figure out which is the profile of biological events due to, mainly due to terroristic attacks. So we built, let me say, a way to profile biological events, take into account not only the types of large-scale effects, but also take into account for policymakers which are the different steps according to the persistence of the specific threats in the biological threats. This was quite crucial in our opinion when we did this research, due to the fact that there are some authors that sustain that the cost related to recovery of biological events are 10 times. This is just one of the paper that we found, but there are evidence in other part of the literature that the recovery phase in biological events is 10 times higher than the chemical and radiological one. I have some doubts on the radiological ones, but for sure for the chemical ones. Taking into account events with the same scale, the same geographical scale. So when we talk about now about biological events, the paradigm is totally different, because we are talking by no more by human-made, let me say, threats, but by, you can say, natural threats. We can say that COVID is the infectious disease with the highest impact in the modern times. We have almost 1.5 million fatalities in less than 1 year. It's something that is spread around the world, in all continents, maybe in all the countries. I'm not aware of a country. If you see the long list of Johns Hopkins University, I think that is quite comprehensive. It's still ongoing. We are in the first wave. We suffered the first wave before summer. We are in the second wave, at least in Europe. And what about the third wave? And again, the vaccine is under investigation, so maybe available at the beginning of. So this is the size of the COVID pandemic respect to the last 20 years. So when we say that COVID-19 is the infectious disease with the highest impact in the modern times, maybe it's not true. This is the picture that I showed before was related just to the last 20 years. We see that looking at the last century, we have different sides of events. And that if you see just exactly 1 century ago, the Spanish flu has a very huge number of deaths around the world, reaching 50 times, 40 times the impact that we are suffering from COVID-19. The response of policymakers, at least at European level, is including this additional effects, that economics effect that were not foreseen when talking about CBRN in the terroristic domain. So this is part of the communication issued in April by the European Commission on global response to COVID. What is recognized is the global dimension. This is the title of the communication, the global dimension of the event. And the macroeconomic shock at the global level is considered. So the natural events such as COVID pandemics includes a number of effects that are not considered in the typical, let me say, cyber terroristic attacks. One of the key points that I'm investigating on my research are there difference between COVID and other high impact pandemics. Just to something provocatory, let me say these two pictures, but we have on the left side of the screen an image of an emergency hospital in Kansas for the Spanish flu, and on the right side a pavilion 5 of the field hospital in Madrid. So we are more or less in a similar situation, which are
Yes, you have 1 or 2 minutes to conclude, Dr. Cavallini. Thank you.
Yeah. The main difference, there are a lot of similarities. We have to say that we are a more connected world. We have more medical knowledge, and we are more prepared to face this kind, and more reactive to face this kind of biological events. On the other side, the vaccine is still to be investigated. So the idea is to understand one of the main differences that we identified in different pandemics in this period is that the one key element is the intensity of the human contacts that we are experiencing in this modern period. So I'm working on a three-dimensional approach to profiling the biological events. So adding to the large-scale effects and the persistence of the effects, a multiplier factor affecting the persistence due to the intensity of human contacts. This can be considered, the human contacts, the intensity can be considered as a spreading factor as well as a resilient source. This with the idea to better support policymakers and decision makers, especially in the response and in the recovery phases. Thank you for your attention.
Thank you very much, Doctor. So I keep in mind the issue between CBRN and public health, right? That we will talk later on, and the fact of the persistence, which is cause the so deep damage into our society. So again, we will have time to rediscuss. So now I would like to give the floor to Mark van der Werf. Mark is a specialist of telehealth and telemedicine, and is a founding board member of the International Society for Telemedicine and Health, and gets some premium position in different companies working on those subjects. So Mark, you got the floor to tell us what telemedicine can help in the COVID, or what have you done already on the COVID issue?
Thank you, Christian, and thank you for inviting me to Paris, but this Zoom just isn't the same.
No.
So let me share my presentation. So everyone, thank you again for inviting me. I think this presentation will tie in a little bit with what Simone was discussing. Again, this is a telemedicine pandemic response plan. Let me give you a little bit of background. In the United States, we have a national infrastructure to support the implementation of telemedicine. Like China, we are a very large country. We have a large part of our country is rural and underserved in many ways in the healthcare space. Healthcare is critical, of course, for the economies of small cities. It's basically an economic engine and an essential service no matter where you go. The work that is done by the organization that I'm in focuses mostly on small and medium healthcare providers, hospitals and clinics across the country. And one of the thoughts is that, huge healthcare systems like Banner, the one that I ran telemedicine for, we have tremendous staffs that can go out and research the development of telemedicine, implement it, oversee it, manage it, et cetera. Small hospitals don't have that. So there are 8 regional centers in the United States that support this activity. And then in the middle of it is something called the National Telemedicine Technology Assessment Resource Center, very long name. But really what its focus is to identify needs and define applications for telemedicine and its related technologies, to test and assess those technologies, and then provide the tools needed to select and implement them for small and medium-sized hospitals in rural areas. I thought it was interesting, and Simona just talked about the fact that we're in their second spike of COVID. As the U.S. went into the first spike, I think the expectations were, although incorrect, that this would be the spike, but our response to the first spike was very poor. So I was asked to lead a task force to look at how putting tools in place to address the next pandemic. Of course, and this study was not to be published until next year.
Mark, we lost you.
Mark, we don't hear you.
Using it in the second spike.
Okay, sorry, Mark, we miss you for 30 seconds. We miss the sound, so if you can come back to the last 30 seconds.
Okay. I'll give it a try. Anyway, this task force was put in place basically to create an action plan for the next pandemic, not for COVID. But because COVID is coming back for a second spike, we've been asked to basically publish a draft of our work so that the work we've done can be used by the healthcare systems now to respond to the second spike and perhaps third spike of COVID. The task force is made up of leading epidemiologists, infection control, hospital executives, public health management, nursing, technology, et cetera. We wanted to identify each of the critical issues that people were facing during the COVID pandemic. And we wanted to look at it from a number of different directions, not only from the infection control, but also from the business issues that the hospitals were trying to deal with, the human issues within the hospitals, the public health issues, nursing, et cetera. So we could really get a multi-dimensional look at each one of these issues. And the whole idea was if we can define the issues, then we can better define what the solutions might be. So the report identifies the issues. It then defines and describes the issues and the specific needs to address those issues. It identifies solutions for each of the key issues using telemedicine and related technologies. And by the way, we took the broadest possible view of what telemedicine looks like. So in addition to people calling into their doctor or a doctor calling a doctor or sharing information, we also included things like chatbots, artificial intelligence, online screening tools, which, by the way, are primarily offered by telemedicine companies in the US. So there's an overlap there. We then documented a plan, and this is really a plan that was designed so that anybody in a rural area can basically pick up this plan and execute it. It's not an academic paper. It's okay. How do you do it, and where are the tools you can get, and how do you implement them today? We then identified examples of each of the technologies that could be used as tools to address the issues. And in the second phase, after, final versus the draft that we're on now, we will actually assess some of the technology for those groups so they know what to expect. And then the last part of it is we've created a very substantial policy regulatory summary to guide policymakers and decision makers as we prepare for the next pandemic. And in the case of the current, some of these can be implemented right away now to address the current pandemic. So the critical areas that we identified are these. There was a tremendous amount of learning in this area also, and I hope that those of you that will go through this plan will see that we have a lot of similarities regardless of where you are in the world. Critical areas, keeping the protocols up to date in COVID is an amazing task. COVID is moving very, very fast. But along with COVID, so are the treatments and the understandings, and the protocols are changing very rapidly. And it is essential that all of the providers in every single facility, all 5,500 hospitals in the US, serving all 360 million people, are kept up to date. In the early stages of COVID, simple things like turning the patient in their bed provided substantial relief and increased survivability for COVID pneumonia. We now are seeing all kinds of different treatments, applications of steroids, other kinds of drug treatments, and other protocols changing rapidly. We need to keep people up to date in order to save lives. It's a major challenge, and we addressed it directly. Keeping the hospital open. It seems like a pretty simple thing, keeping a hospital open. But in this circumstance, it's not. We looked at operations, we looked at supply delivery, we looked at care delivery, how it's done, by whom, how do you staff, how do you maintain quality? And one of the biggest impacts in the United States, because of the way we fund our hospitals, and as many of you may know, our hospitals are basically funded by billing for the services they provide. The average healthcare delivery organization in the United States lost 40% of their revenues in one quarter. So imagine the businesses or the governments that you work in today. What if your revenue dropped 40% in 90 days? How do we address that? Third was to, again, divert the potentially infected. You don't want people bringing additional infection into the places where you need to take care of patients. So really looking at advanced screening tools to screen the patients before the appointment is even made, diverting them appropriately, eliminating the waiting room, using queuing technologies, eliminating the need for them to even enter the facility by allowing them to do a consult over telemedicine. Looking at every direction to try and divert the infected away from an environment that you don't want compromised. Fourth was how do we replace and cover for infected staff? That's a major issue here. We've had deaths, especially in New York, around healthcare workers. We have healthcare workers that are being infected and having to be quarantined and therefore out of service. How do we do this? By using, again, technology to bring in, if you will, locum tenens, temporary physicians, temporary staff to support the current staff within the hospital. And we looked at this pace from a variety of different needs. COVID containment in the hospital. How do you keep people from crossing the infection within a hospital? Are there technologies that we can use so that people don't have to go into the room? They can see the patient at a distance and therefore not have to be exposed to infection and not exposing the next patient to infection, but also reducing the consumption of personal protection information or equipment.
Mark, you have 2 to 3 minutes to conclude. Thank you.
Okay. Bottom line is we went through each of the major issues within a hospital. We use the COVID epidemic as our example. And from that, we've developed a plan that people can basically approach it directly. And each part of the plan, just give you a preview, and I'll just use an example. It's the number 2 on there. We define the issues in depth. We go into it in significant depth. And then we go into every single idea solution to address all the issues that are within that problem. So, and you kind of go through here, using tools, assuring technology, keeping infected people out of here. One of the most useful things that we found was the use of pad on pole, putting an iPad on a pole in the patient's room so that they can not only communicate with their loved ones and their providers, but the nurses didn't have to go in the room and see them. They can see them over video, saving infection from the exposure for the nurses, and also saving personal protective equipment. Again, every problem is broken down into solutions. The solutions then go one level lower. When it uses a technology, we developed lists of the potential technologies that would answer that problem. In addition, at the bottom of the page, you can see we put articles to give evidence of how these things have been applied and how successful they've been. So the people applying these solutions can have a basis for their work. They're not working in the dark. They can actually go to examples and see how it was done somewhere else. And that is it. Now I'm giving you my email account. You're willing to perfectly able to use that and contact me. The document will be published at the end of December, and it will be published through that website that you see at the bottom, which is the website for the TTAC organization. Again, that'll be available at the end of the month. If you want to have any questions about getting it or have any questions specific to it, just contact me directly. Thank you.
Sorry, thank you very much. And maybe we will have also some question. I think that those new technology can help many people in a global situation that the one we live now. I would like to give the floor to Professor Vinan Chandra Menon, who is a founder of member of the National Disaster Management Authority in the government of India, and now is a consultant in disaster risk reduction, climate change, adaptation, and public policy analysis. So I would like to give the floor, sir, for 15 minutes because we are a little bit late already. And I think that you are going to speak to us about the humanitarian issues, which will make the link with the first presentation of Dr. Kyung. So please. We cannot hear you. Please open your microphone. Dr. Menon, please open your microphone. Microphone is on the left, bottom left. You have to open it. It must be green, not red. Bottom left, the microphone on the Zoom interface. We cannot hear you still.
Can you hear me now?
Yes, now we can hear you. That's good.
Okay. Are you able to see my
Yes,
screen?
we can see, and you can put it in a full scale and so full presentation, which is on the bottom right of the PowerPoint.
Just a minute.
Before the scale, you have a button you can click on.
Just a minute.
Or if you can successfully, we can read enough. Don't worry, you can go through the slides because we are already late.
Okay.
So please proceed.
Yes, actually, thank you very much for giving me this opportunity to share some thoughts on the way in which the COVID experience has actually given us a major shock in 217 countries around the world. And so we feel that actually, it is necessary for us to really look at the opportunity for are you able to see the screen now?
No, you can click directly on the slide you want to show, and that should work. Yeah, good.
Yeah,
So go
okay,
ahead.
thank you. So I would basically like to mention that 2020 with the COVID-19, we are seeing humanity at the crossroads. Just cover the background and context and look at the challenges facing humanity in the 21st century with COVID-19 and understand the scale of impact in 217 countries. And can we look at 2020 to 2030 as a decade for hope for humanity? And understand that partnerships are the most important SDG, the Sustainable Development Goal. And wonderful presentations from all the panelists, distinguished panelists, and we need to really look at the current situation we are all in. Global consensus on four major frameworks, during the 2015 to 2030. The Sendai Framework for Disaster Risk Reduction, SFDRR for vulnerability reduction and for looking at disaster risk reduction globally, and the Paris Agreement on Climate Change, Sustainable Development Goals with 17 goals, and the new urban agenda of habitat. And so these are four major frameworks which we need to work with, and we only have another 10 years. We finished 5 years out of these four frameworks, and we have 2020 to 2030 as the challenging decade. So emergency management, disaster escape, many of the presentations from many countries in Europe have looked at disasters, anthropogenic epidemics and industrial disasters, as was very clearly mentioned also by Dr. Simona, and climate change induced hydrometeorological disasters, extreme events and conflict and terrorism. These are major events which are actually affecting people across many countries. So what are the challenges facing humanity as of now? We have poverty and deprivation, which has actually been worsened with the COVID-19. We have many countries affected, 217 countries affected, and large numbers of people, millions of people, suffering with poverty and deprivation, malnutrition and hunger, and widening extreme inequality, and the indiscriminate resource exploitation, whether it is water or oil or timber. We have indiscriminate resource exploitation happening, and gender inequality and discrimination based on ethnicity and gender are some of the challenges. And we have seen the way in which these 217 countries have been affected. We have 63 million people in the world, with 1.47 million people who lost their lives officially. And we know that all these countries have been affected. And then we have the example from Kerala, from India, where we have the work which is actually happening. We can actually see the way in which the 30th January 2020 was the first case of COVID-19 which came to India from Wuhan, China, and from a student who came to Kerala. And then we saw this actually happening, and then you can see that Kerala is actually now number 2 in this. And then you can see the Kerala becoming also the state with the largest number of cases by the 24th of March. And then we had the lockdown announced by the government. And then we have 5 lockdowns which happened. And then you can see that Maharashtra started coming up with large numbers of cases. And then you can see the Kerala coming down because of testing, treating, tracking, and tracing. By geofencing, by using technology, IT-enabled solutions of geofencing and tracking, tracing, preparing route maps of people and so on, we could actually see that Kerala started dropping the number of cases. And you can see that over the next few weeks, we can actually see by the 10th of April, we see Kerala coming down to the 10th position in the state. And you've seen actually that the Health Minister of Kerala was appreciated for the work which she was doing. Shailaja Teacher, the Health Minister of Kerala, was appreciated also by the UN and globally appreciated for the work which was done. Now, this is something which we need to really see and understand in terms of the explosion of urbanization which is happening in many parts of the world. We have 26 mega cities which will be having 10 million plus population by 2025. And this needs behavior change communication differently because, you know, on the one hand, we have the shanty towns, the slums, and then you have multi-story apartments which are also there in these mega cities. And you see that in all this, you know, the cities, you can see that all of them have these urban cities, mega cities, all have large population which are staying in the slums. And we need to really understand how this can actually be through effective communication, through multiple media. And you know, we need to really look at that and then prepare ourselves for the vaccine when the vaccine gets available. Now, 91 million migrant workers are there in the Asia Pacific, which is 1/3 of the total global migrant workforce. And we see that the impact of on the employment and loss of jobs of these migrant workers in the Asia Pacific countries is estimated to lead to remittance losses ranging from $31.4 billion to $54.3 billion in 2020. And the Asian Development Bank estimates the impact of COVID to be between 5.4 trillion to 8.8 trillion because of the economies adversely affected. And Mahami Mizutori, the head of UNDRR and the SRSG, has estimated that the economic damage could probably be in the order of $10 trillion. Now, the impact has been multifold in terms of, you know, loss of lives, loss of livelihoods, loss of jobs, salary cuts and partial payments, layoffs and terminations, and work from home. The myth and reality, actually, there are many people who cannot work from home. They have to go out and work. You know, these include the informal, unorganized sector, the migrant workers, and you know, the people who are actually agricultural laborers, and many others, you know, fruit vendors, vegetable vendors, and so on. And the impact on access to healthcare. Many people actually had to compromise in terms of the healthcare needs. Many of the elective surgeries were actually, you know, kept aside, and then COVID became primacy in many places. So access to education, online education was to be encouraged, but then there was difficulties in terms of access because of lack of access to internet, you know, the computers, laptops, and smartphones, and so on. Access to social protection, access to food security, and violence against women and children, and finally, depression, trauma, and suicidal tendencies. This has happened in many countries in many parts of the world. So we need to understand how it is affected. And when the lockdown is announced, we saw, you know, millions of people actually traveling, walking back, cycling back into their villages. And in terms of technology, actually, you know, the remote areas in the rural areas, you know, we had to have, you know, the people's using physical distancing and wearing masks, and also frequent hand washing, but at the same time using the walls for blackboards for education, because they could not afford to have online education in the rural areas and so on. So these are some of the issues. And the vulnerable sections, you know, we have to look at the excluded sections, minorities and weaker sections, transgender people, elderly people, palliative care patients, people who are going through kidney dialysis, chemotherapy, radiation, and so on, differently able people, and migrant workers, immigrant workers in different countries, women-headed households, women and children facing violence, abused and trafficked women and children, and stateless people, the people who are actually fleeing from their countries, trying to find asylum. And Dr. Mike Ryan, head of the WHO Epidemics Response, mentioned this on a video on the 14th of March. We have to be fast and we must have no regrets. And you must be the first mover. And Dr. Mark mentioned this also. The virus will always get you if you don't move quickly. And if you need to be right before you move, you will never win. And perfection is the enemy of the good when it comes to emergency management. Speed trumps perfection. The problem in society at the moment, everyone is afraid of the consequences of error. And the greatest error is not to move, to be paralyzed by the fear of failure. And we cannot afford to lose, and that we know with great certainty. And we need to ensure that we don't leave anyone behind, leave no one behind and do no harm. And inclusion as affirmative action, social inclusion, financial inclusion, physical inclusion, electoral inclusion, emotional inclusion, digital inclusion, and participation in decision-making by the people who are actually not able to express themselves. And we need to ensure that. And multi-stakeholder engagement is necessary. COVID-19 is the greatest challenge of our time, said Antonio Guterres, Secretary General of the UN. And he said, we are not powerless. We must persevere and confront the crisis together, following science and demonstrating unity, solidarity, and integrity. And he also said, disasters cost hundreds of billions of dollars, hitting the poorest countries disproportionately and pushing millions into poverty. And we must tackle disaster risks and leave a more resilient planet to future generations. This is something which I think is a very beautiful poem. I will conclude with that. It says, my soul has a hat. And by Mario de Andrade, a Brazilian poet, he said, I counted my years and realized that I have less time to live by. And than I have lived so far. I feel like a child who won a pack of candies. At first, he ate them with pleasure, but when he realized that there was little left, he began to taste them intensely. I have no time for endless meetings where the statutes, rules, procedures, and internal regulations are discussed, knowing that nothing will be done. I no longer have the patience to stand absurd people who, despite their chronological age, have not grown up. My time is too short. I want the essence. My spirit is in a hurry. I do not have much candy in the package anymore. I want to live next to humans, very realistic people who know how to laugh at their mistakes, who are not inflated by their own triumphs and who take responsibility for their actions. And he says, in this way, human dignity is defended and we live in truth and honesty. It's the essentials that make life useful. I want to surround myself with people who know how to touch the hearts of those whom hard strokes of life have learned to grow with sweet touches of the soul. Yes, I'm in a hurry. I'm in a hurry to live with the intensity that only maturity can give. I do not intend to waste any of the remaining desserts. I'm sure they will be exquisite, much more than those eaten so far. My goal is to reach the end satisfied and at peace with my loved ones and my conscience. We have two lives, and the second begins when you realize that you only have one. I'll repeat this last sentence. We have two lives, and the second begins when you realize you only have one. And that is where we are. I want to thank all of you for giving me this opportunity to share, some of these thoughts. Thank you very much. We need to stand together and we have to work together. Collaboration and partnerships is the strongest sustainable development goal. And I assure you all cooperation and support from India. Thank you very much.
Thank you very much, Professor, for this these global approaches, also this, I would say, universal recommendations, which makes always good. Now I would like to take some questions from the floor. We are 41 participants and 10 speakers. And in the meantime, we have one, and I don't know to whom, but maybe I'm going to read it. The pharmaceutical industry has not been successful in making the vaccine against COVID-19 in time. I'm not sure that I'm agree with that, because I think the rush has never been so fast, and they come with some results at the time. And there are some reports that the US has successfully made the vaccine. Will it be available for other countries? I think different countries make the vaccine. I think you have vaccine in China, you have vaccine in France working on, not really delivered yet. You have vaccine in UK, with Germany. You have vaccine in the US, of course, as well, and maybe others. So who wants to answer to this question about vaccine? Are we ready to deliver vaccine? Maybe in China, what is the status of the vaccine today, Professor?
It's a very it's a great question, but it also is a very hard question, because as you know, we have some a Chinese company to participate in those vaccine, but unfortunately now we just support some. It's during the testing, another thing is not open to the public. It's also, I mean, you know, just do, I mean, for testing and some special, I mean, task for, I mean, the international travel or international business, something. So I think it's also it's a big issue in China, because at the same time, it's another issue is like we also work with. I think it's a good phenomenon, because even I just say there was some Chinese company and the Chinese government to support. We also work with international companies. I think it's good, because it's like we can test the different, I mean, those ways to produce a vaccine.
But at the time, the vaccine has not been delivered to the population. It's just under a large-scale test for human. Yeah, right. Okay, thank you. Maybe Mark, a word on the vaccine.
Yeah, there's basically 3 vaccines being in process in the United States. There's one by Pfizer and another one by Moderna. Yeah. They're both international development projects. Yeah. They have now finished their clinical trials. They have finished their initial safety trials, and I believe they've both submitted for emergency release for the FDA, and that just started Tuesday, so that's very current. We're also looking at AstraZeneca, the one that was developed in England with Oxford.
Yeah.
Availability for the first 2 they're really looking at potentially by the very end of December. AstraZeneca, I don't know there's a timing, because there's no application for emergency relief. But again, if you're looking for a time, you know, call it January 1st.
Yeah, I think 2021, as the slide of Professor Menon shows, that will be with the mask and maybe the vaccine, and 19 was only with the mask. We had no other choice. Now, I would like to ask if you have other questions before we go to the second part of our afternoon, at least in Europe. And I would like to introduce Eric Barbet, which will be the co-chair with me of this second part. So maybe, Eric, can you introduce yourself in a minute? And after, I will tell you a little bit what we are going to do in the next 45 minutes, 1 hour together.
Can you hear me?
Yes, Eric, we can hear you.
I'm Eric Barbet. I'm working for the French government in crisis management. And I follow this crisis with other people of the ministry. I'm working for the Ministry of Environment, so we follow problems of transport, environment, waste management, etc.
Okay, thank you, Eric. So we are going to speak about 4 main subjects. I would like to introduce the first one, what I've called coordination. Coordination, why? Because we are facing a global pandemics, and we see that from the international, national, regional, local, including, when I say local, I mean counties or cities or megapole, and up to corporation, companies, everybody must have a kind of a crisis plan, or must have a crisis, emergency and crisis plan. But I mean until almost the family level. And I would like to understand better if in your countries, the system of emergency management for this crisis of the COVID-19 change compared to another big disasters, which would be natural or any kind of terrorism or whatever, which has been occurred already. Usually countries develop plan, develop organization for responding to this kind of specific event. They have their organization of emergency management, large scale. And I would like to know if this systems was good enough or has been strong enough to respond to the crisis, or that the states or the national, regional and local level had to recreate a specific organization to handle this crisis. I think that could be interesting to compare the views of you. What's happened in Italy, what's happened in China, what's happened in India, what's happened in the US. Maybe if you can give us. So I'm going to start by China. We follow the the round of the presentation. Professor Kyung, is China has changed the emergency management system to respond to this crisis? Professor Kyung, you get the floor. It seems that he is frozen. Maybe he has a problem. So I'm going to jump to Dr. Cavallini. Is in Italy. Do the Italian state change the way he handled the crisis compared to other disasters?
Yeah, for sure. I think that this more or less happened in all the countries of the world. I think that the main reason for we change our emergency management approach is due to what I mentioned in my presentation, persistence. So we are used to natural disasters such as earthquakes, floodings, landslides. And when you have this kind of emergencies, first of all, are localized. So as they are spread in the territories, but in most of the time are very localized. So the other 90% of the country is not affected. So also resources can be concentrated in a single point to address the recovery. Second point is related to the persistence. So this system, when something occurs, sometimes you have to start the minute after just to think to recover and not to avoid again the threat. So we needed to change this approach. The civil protection, the Italian civil protection is, I think, one of the most best performing let me say, in the world. So we have a very good reputation in terms of civil protection, but we have to change the way to act. We have to face administrative issues, for instance, related to the procurement. So we did special, let me say, laws for procurement, and we had a lot of issues. Another aspect that should be considered in Italy is that the health management, the health services management is delocalized to regions. So we have to cope with a national approach and the regional needs. And this is the reason for, I think, the choice in the first wave of COVID of national lockdown, because regions were not prepared to addressing so huge challenge. In the second wave, we delegate more responsibility to regions. This is because, so guided at national level, were established a technical committee taking decision, but now some rules are applied to regions. So for sure, we changed the approach. The second question is, does it work? Is it working, and did it work? The first huge emergency that we had to face was the health system. We have a very fragile health system before the COVID, especially in some regions. Then with some recovery, some investments, we increased the capacity of the health system to address this challenge. And this was one of the most challenging aspect that we have to face. In the second wave, we were more prepared from the side of the health system. On the other side, we experienced a more spread in the country contamination. During the first phase, essentially 3-4 regions were affected with the most of the cases and the deaths. Now we are facing in Italy a spread COVID-19 pandemic. So it seems that the situation is changing. So it's not comparable, the first wave to the second one. So we solved some issue in the first wave, but we have new ones in the second one.
Thank you, Professor. Yes, I think that it was the same in France. A lot of things have changed. We will come back, but I would like to come back to Professor Kyung to ask him again, is China emergency management system was ready and strong enough to cope with the COVID, or do you had to make some change in the organization?
Yes, it's a big challenging for the emergency management system in China. So now I think those big changes. I think there are a lot, but I just give you some. I mean those. I think the bigger directions. The first thing is about within the government system, because before our Ministry of the Emergency Management just take care of the natural disaster and I mean those incidents. So now how this the Ministry of the MEM work with those I mean the Ministry of the Public Health. So how we can work together. So I think that's the big change and a big issue for the future. The second thing is how we can use those top-down systems to support those bottom-up approach. Because in China we face a huge challenge because we have more than, you can think about it, more than 50,000 in communities. So it's a huge number. So then, I mean, those communities is isolated during the pandemic. So how can you deliver those services? I mean, it's not just about those medical services. It's also about those livelihood. So you can think about it. That's a big system. So now we try to, I mean, it's like shift the system. It's like we should enhance those community-based resilience. So I think it's not just from the government system. It's also work with the private, private sector to deliver those services. I mean, it's like the public service and the commercial service and the voluntary service that integrate to the I think the elderly people. The third change is about, I mean, as Mark mentioned, we involve a lot of ICT technology. It's like we can do a lot of things online. So how we can control the quality control? I mean, we need more, I mean, those the standards. So the more equipment, and I think it's also more education. It's like a more consensus on we can involve, we can engage those new technologies into, at the same time, how we can help those poor area, because it's like maybe more gap. I mean, those ICT gap. So how we can help those poor area. I think I just give you, I mean, those samples you can think about. Thank you very much.
Thank you, thank you. Mark, do you feel that the FEMA was there or not enough regarding the magnitude of the crisis in the US?
And speaking, not as a member of the
No.
of part of the organization, but from the standpoint of all the people on this task force, is we proved very, very quickly that the planning was insufficient. Again, like Dr. Cavallini said, a lot of the dependence in the United States is regionalization. That if something hits Florida, Washington can help them because they're not both hit by the same disaster. Because it was hitting everybody at the same time, we didn't have the ability to move around resources. That was a very big challenge. Huge challenge here was inventory management and understanding what we were going to get hit by, and identifying it quickly that we're going to run out of things quickly. That could have been managed better. The supplies were sent out and we didn't have any more supplies. And that was a major gap. Another major gap that was identified here was the public health system. Frankly, we haven't had a major public health thing happen in the United States for many, many decades. And I think it fell kind of on deaf ears a little bit for a while. It got tired. And they were unable to respond as well as they should have in many ways. Another major problem here was, of course, as you've all heard, and I'm a little embarrassed to talk about, the politicization of this, which really ended up damaging other areas. The other thing was that because of the politicization, the main thing that the US lost in the politicization was there was no longer any central direction. The center was telling us different messages. And that was the worst possible thing to happen in a public health emergency. Shifting the messaging then went to the states. The states, frankly, are in a position to do it. And they're struggling. They're doing the best job they can. But the lack of a central authority definitely hurt us and hurt us quite a bit. The things that did work here were the very quick application of technology, both in the development of treatments and the sharing of resources, through things like telemedicine and shared data, shared resources in that area. And of course, another thing that worked here fairly well, and again, this is a response to a failure of a plan, not a plan. It turns out that the emergency production capabilities of the US are still as strong as can be, and we were able to respond. But again, it wasn't because the plan was there, it was because the capability was there. The bottom line is, the reason I think I was brought in is because everybody realized that the plan wasn't done very well, and that's why we are coming up with a different plan.
Thank you very much. Professor Vinod, in India, does the emergency management systems could deal with that, or it has been done at the regional level because you have a so huge country? It has been more regional or more national response?
I think in the Indian context, what was actually striking was that the National Disaster Management Authority and the Ministry of Home Affairs decided to have the Ministry of Health and Family Welfare coordinate this response and preparedness. And that was actually something which really helped, because all state governments, which the provincial governments actually have the Department of Health, which was actually helping in terms of coordinating with all the hospitals, both government hospitals and private hospitals. And so the Ministry of Health and Family Welfare and the Indian Council of Medical Research, the agency like the CDC in the US, was actually coordinating the serosurveillance studies and also putting together the protocols for testing kits as well as the testing. We had a problem in terms of the supply for testing kits, and also deciding what will be the most appropriate testing kit which needs to be used, whether it is the rapid antigen or whether it is the RT-PCR. And I think most countries went through that kind of a confusion. We need to be consistent, and we need to be definitive about whatever we are saying. And I think CDC just last week came up with this report that 100 million people in the US could possibly be infected. And similarly in India, the ICMR serosurveillance study said 74 million people could have been infected by August. So this is actually very worrying, because when we know that people are moving around, untested, infected people are moving around, then the transmission actually happens. And Dr. Mark actually, so we would be very happy to understand the response plan which you were suggesting, and it'll be very useful, if we can share this across countries, and then be responsible in sharing these, because we have this problem about supply chain logistics of testing kits, N95 masks, PPE kits, ventilators, ICU beds, and also the clinical management. What is the therapeutics and what is the clinical management? What should be used? I think these are questions which kept on transitioning as we get to know more information. So technology, as you very rightly said, Dr. Mark, is very, very useful. AI, modeling, understanding these kind of implications, using AI algorithms and also machine learning will really help. Thank you very much.
Thank you. I'm not sure that we could answer to all those questions within a time frame of our conference, but at least the exchange is done, and the email can be shared as well. Maybe we can make a point to what's happened in France with Eric. Could you describe maybe in a few minutes what the change in the organization and how it has been carried out for the first and the second wave that we are still on, Eric?
I think that one of the problems is that it's a long-term crisis. So it's hard to keep people mobilized for a long time. And I think scientific data are moving from the beginning of the crisis to today. So it's not easy to communicate to people such uncertainty, and it's not fun. Uncertain data, not easy to communicate to people. So we can see that different styles are possible. We can use authority, we can use responsibility, trying to make people responsible. And we can see this, this hesitation. So we can see in other countries like Sweden, other styles. And perhaps it would be interesting to question people about what is used in their country, in China, India. Yes, is it more responsibility, more authority?
Yeah, there is a we can say there is an issue in Europe regarding the cost of the pandemic and the impact on certain category of businesses that we are too focusing on public health safety, and the cost is tremendous compared to the real end of living life, saving life, because finally with new process and so on, the 90, more than 95 or up to 99% in different situations of lives are saved by hospitalization. And regarding the criteria, at least in France, but I think it's the same in Italy, the criteria for the politicians came to be the saturation of ICU beds. And the saturation of 50% should be a maximum as a new threshold. Is this saturation level is the same everywhere? Does it is a driver to conduct the crisis, or do we consider the global impact as a driver for the crisis? And it seems that, as you mentioned, Eric, it's not a short-term crisis, and as mentioned Dr. Cavallini as well. I mean, it's a long-term crisis, and it's not ending. We don't know if we will not have a third wave, and how to be prepared for the next wave, and how to balance the public health response, the global economy, and is the vaccine is going to be the solution or not completely, because maybe, at least in Europe, we know that many people are against the vaccine for different personal reason. And in France, the vaccine will not be mandatory. It has been announced by our president this week. So, I mean, how to combine those response between the pure public health protection, the pure economy live, and to maintain a country in order of work. It's and we see that it's very difficult crisis for the political people. I mean, elected people, because they are in the middle of an unknown field. And they don't like that, of course, like everyone. But we have seen some reaction in the US that we forget about the virus for a couple of weeks. In France, we take too much place to the virus, so nothing else exists for, and so on and so on. So we have seen very opposite directions at some point. China has been very focused on public health issue in Wuhan and in other parts of the country. We have seen that very deeply, and the success was there. South Korea also. So what is the best solution, and what would be your recommendation? Now, again, I'm going to do a tour, and maybe we can start by Professor Kyung.
So you mean, I'm sorry, I just lost your voice. So the question is about the accommodation for the next step.
Now, yeah, the question is about the balance between the pure public health, the economy, and how politically, on a long-term crisis like this one, you have to conduct
Yes.
the crisis management.
I got it. Yeah, it's it's a very struggling question. Yeah, so I think as you know, we just issued a suggestion the draft suggestion for the next 5 years. So in China, we have this style. I mean, the 5 years we will have the 5 years plan. So in the draft, we suggest it's like how to balance. So now we have the first things is about the idea, the national strategy. So we announced that we put the safety is as I mean a very it's a priority. Same as it's the same the position as development. It's like if we say the function of the government, we just have two things. One thing is the development. Another thing is keep people safe. That's ideally. And another thing is for economy. So we say we have the two cycle. One cycle is mobilize our internal marketing. Because China is a very huge market, but how we can, stimulate those more, the consumption from the internal market. At the same time, we should rely on those. So we keep our, how we should, we cannot give up those international collaboration. It's like globalization. So it's like we have the two cycle. One cycle internal, and another cycle is those more and more international collaboration. So then we can collect those. It's like link those domestic and international market. That's the idea. Another thing is like. I think it's we put more resources on those the community level. That means one thing is we can put more, deliver more service. At the same time, it's also stimulate our economical development, because it's we can deliver the more service, and we also issue the policies like engage more private sector. I think the last thing is very important, because it's we say it's innovation. Innovation is not just for the high tech. It's also for our those how we can find an innovative way to collaborate, because it's a soft tech. It's not just a high tech. We need so very fancy and technologies. No, not only. We need more, those new business model, new service model. Then we can, we can mobilize, we can start up those new cycles. So that's the idea. So thank you very much.
Thank you. Dr. Cavellini, what would be the recommendation, or what you see as the next step for Italy in this crisis management organization and situation?
Very good question. I think that no one has the right receipt about the balance between public health and economic profits or conditions. I think that no one has the good receipt, and the receipt change according to the structural condition of the countries. So when referring also to the intervention of Mark, in Italy we have a universal public service. So it's supposed that all the people, all the citizens can ask and receive care, also for COVID. And we have a limited number of intensive care beds. So it's something that should be addressed. In Italy, the first wave created a lot of frustration in people due to economic losses and socioeconomic conditions. And this is because my personal experience is that my family is from Piemonte, that is one of the most affected regions in the first phase, and I live in Rome. And was not perceived the importance of health here in Rome, because no one was affected, or very few people were affected. While in the northern part of Italy, health was on the top priority also of citizens, because people see parents, friends hospitalized. So the idea of the general lockdown caused a very huge impact in economic aspects and didn't solve the health issues suffered by the local and regional citizens. The second wave, I think, was managed or is going to be managed with this approach. What I can say is that we decided the government decided to use 21 indicators about the situation of each region, and the region are asked to populate the indicators to understand which of the four possible scenarios, to which of the four possible scenarios each region belong. So we have the green, the yellow, the orange, and the red one. In the red one, you have lockdown. In the green one, no one in Italy now, but you have in yellow one some restrictions. But lockdown is only for red regions. And these indicators are based on two main elements. One is the actual condition of the regional health system. So, for instance, the number of free intensive care beds. And this is the actual condition. The second group of indicators is based on the capacity of the health system to be informed about contamination and management of the health. So something like how many cases are directly identified and how many on the number of patients COVID affected, because the health system is not able to monitor the contamination paths of the. So if the health system is able to manage the COVID contamination, they raise the quality of the service in some sense, and not only the intensive care beds availability, so they can gain, let me say, the yellow position or the green position. So the way that Italian government follow is based on the health condition, so input to the mechanism.
Just a question: the number of people infected is more important than the place available in ICU, or what is the driver?
There are 21 indicators. These are just two examples, but all the indicators are related to the health conditions of the regions, and the output is a color for each severity color of each regions that impact on the economic conditions. For instance, in the red regions, you have closed restaurants. In the orange one, we have restaurants open for some period of the day. In the yellow one is extended. Green is not existing, is the old way to life. So it's the inputs is totally related to the public health conditions. As better is the public health condition, better is also the economic response.
Thank you, Mark. How with its second wave, the US is handling the balance between the economy and the public health? We lost you. Open your microphone.
Thank you.
Yes.
It's a tough question. It depends on where you are in the country. This country is 51 governments. In addition, we have native peoples that have their own governments and run their own nations within the nation. So that makes things a little more complicated here. Generally speaking, the balance has not worked very well in most states. There are exceptions. But the balance of the political, the economic, and the health haven't worked well together. And frankly, the political and the economic have taken a higher seat than the public health piece. And I think we're paying a price for it. I mean, the US has got just under 5% of the world's population. We have just over 20% of the people who have died. So it has not worked well. There are things that I think that we're learning and are being used as examples. A good example is the Cherokee Nation. They're a nation of native peoples in Oklahoma, one of the highest infection states in the nation. Yet in their nation, within the nation, their infection rates are 1/10. And the difference is that they put public health first. It's the only difference between the nation and a city 20 miles away that has 10 times the infection rate is the fact that they follow basically public health and science instead of, politics and economics. And the interesting thing is because of that, they're of course the equivalent of the Italian green state. They can be on the streets, they can be out there. They're wearing masks, but we really have to learn from some of those examples. Will we learn? No guarantees. Okay, it's like raising children sometimes. Some of the things that Dr. Zhang talked about was some of the things are very simple. Again, turning a patient during the pneumonia saved a heck of a lot of lives. There was no technology involved. It was just a matter of communicating around the country. Turn the patient. And then there's at the other end, higher technology solutions. One of the problems here, of course, is ICU beds. We're running out of ICU beds. So how can you use technology to expand the number of ICU beds? An ICU bed is a very difficult challenge. It requires intensivists, a special trained physician to handle it. It requires critical care nurses that are trained in a different way than the rest of the nurses on the floor. So it's difficult to create a bed. So what we're using in a lot of the systems are called tele-ICU, where we basically bring the technology and the intensivists and the critical care nurses virtually into the patient's room. So a room can be converted fairly quickly from a ward room to an ICU bed without the investment in the technology, the infrastructure, and trying to find more rare resources. So political, economic, I hope we do a better job. How's that, Christian? Next time, yeah. I hope we learn from ourselves.
Everybody's learning from everyone in this crisis, I think.
Right. Yeah, I think you're right.
Professor Vinod, maybe a view from India regarding the balance between the economy and the public health in a country where the economy is growing, is booming, but still fragile. Open your microphone, please.
Yes. Yeah. Actually, as Dr. Mark said, I like that phrase. You said public health and science should actually take over and not politics and economics. I think in the Indian context, we need to also see that it's not either or situation between public health or economy. It has to be, it's not lives or livelihoods. It has to be, it's not an either or, it has to be both. And so how do we do that? I think that is a challenge that most governments had to face. So maybe, we need to really look at what is the support which we can give to small enterprises, artisans, craft people, informal, unorganized workers, food security for people. And so small grants were given, small bank transfers were made to people who really were extremely vulnerable. So similarly, moratorium on loans for small scale industrial units and so on, MSMEs, micro and medium and small enterprises, moratoriums are given. So these are some of the things which are done. But I think most important message is that, we also saw the resilience, adaptation and innovation happening. How most of these stakeholder groups responded was by, adapting to this crisis, both in terms of education, in terms of jobs. There was a challenge about physical distancing when we had cyclones and floods, hurricanes. When you have a hurricane and when you actually have people in the relief camp, you cannot do really physical distancing when you have thousands of people in a relief camp. So these are some of the challenges, but at the same time, I think COVID has really taught us to be really more considerate towards the problems of the weaker sections. Elderly care, palliative care, people in old age homes and care homes. That I think is a message which is there. People in institutions need support and they need to be protected. And I think that is one of the biggest messages which are there. And as Dr. Mark said very rightly, proning helped a lot of saving lives. Similarly, apart from clinical management or therapeutics, even looking at convalescent plasma to be used as plasma therapy US Surgeon General has also said that this is something which could be attempted. So CDC had, gone back and forth on this issue. So similarly, we need to have these kind of definitive options which can save lives. I think adaptation and innovation is extremely important. Thank you. Oh, we can't hear you.
Yeah, you're right. Me too. I was asking to Eric if he can give a word before we go for conclusion, because it's really close to 4 p.m. To see this balance in Europe between the economy and the public health. As far we know that we are at the starting in France the end of the second wave, and probably we will have a potential third wave, like many specialists think about. How do you think we can continue in a long-term crisis like this one, and how to balance the action of the between the economy, the public health, and the personal responsibility, which is still, especially in Europe, a problem with our citizens, which are very very independent each other. So and hard to follow the behavior the government has sometimes. So maybe a view on that.
I think it's interesting to notice that in 1918, for the Spanish flu, government was accused to take decisions which was not scientifically founded. And it was not the case for this crisis, because we have in France a scientific council. So some people may say that it's a medical power, but we can see that we may cope with acceptability of people. So I think there's a better balance than in the past years, and perhaps we will improve it. And we will have more and more data, I think, about transmission, the condition of transmission of COVID-19. So we can think that we would improve our gestion, way of coping with COVID-19. Thank you.
Okay, thank you. I think we are going to end within 2 minutes. Me, I would like just to make a conclusion, because I think that the public, the cost of health, usually, largely speaking, has been often underestimated in many countries, and it's this COVID-19 brings up the limitation of our health system, and moreover the public health systems. We can see that we have a lack of medical resources. There are doctors that we have not trained for many years, and the lack of doctors is everywhere. It's not only in Europe, in US, a little bit everywhere, in China as well. I mean, we miss doctors, so we don't invest. And I think that this crisis will call us think about what is the meaning of the health and the public health in the 21st century. And I think that will be a big part of the new economy that we will have to think after, with the ecological climate change adaptation transition and so on, energy transition. I would like also to see the issue of on emergency crisis management, the issue of the persistence of a threat, and the long-term emergency crisis management. This can be work only if you have very well trained people, many people trained, so that you have focus on this issue of emergency training management with good system and in a collaboration way with the different levels. And it's a lot of work still to do, because many of the citizens were thinking that there will be always someone to help me. That's true, at least in developed countries, and that is not true anymore when we see the level of activities of the different services, hospitals, medical, even in sometimes civil protection or firefighters. So the think also of personal, individual behavior protection, the question of the PPE, the personal protective equipment on long term for other crises is probably to raise, because we are not going to produce a billion of masks like that. I think we will have to have probably other products which were more developed, reusable, less costly, and with less damage to the environment. So a lot of things are coming up with this crisis. I think we will have work enough in the International Emergency Management Society to speak for 20 years about this crisis and all the lessons learned. So I think that it's going to be a very a deep concern for a long time. So I thank you everyone for participating. It's 4 p.m. I think that we have to give the floor and to end this session. And thank you very much to all the speakers. Thank you to the attendants. We have been up to 70. We are living at 50 altogether. Don't forget that you have the small poll to answer before to leave. Alors, unfortunately, it's not for the speaker. They cannot they cannot feel it. So speakers, don't worry. But for the others, please put your comments. You can scroll it in order. You have 6 questions, and please answer to those 6 questions. It's very fast, 1 or 2 minutes, and after that we will officially end this session. So again, thank you very much. Thank you very much again. Have a good day, and we will see you, and I hope on the next session of the TIEMS conference, because as you know, we are together up to Thursday. So thank you very much, and have a good day. Bye-bye.